Welcome back to Wave 3 Listens. It's all about beauty at the Physician Center for Beauty when you want to look your very best, and that's the spot to go to. And we do it often here on Wave 3 Listens. Very impressed with a very respected Dr. Sean McGuire, but also very impressed with Marilyn Cannon, who's the skincare expert at the Physician Center for Beauty. Marilyn, welcome back to the show.
Thank you.
All right, delving into hormone therapy, before I get into my questions here, you're always approached at an entity like yours,
yes,
with different kinds of products and procedures. Why BioTE hormone therapy?
Well, BioTE, well, first off, let's talk about why hormone therapy.
There we go.
Okay, so there's, we're talking about natural hormone replacement therapy. You know, we have addressed the outside of people's appearance, both men and women, for over 12 years, and we do it really well, you know, with injectables like Botox, Dysport, dermal fillers. We do a lot of aesthetic services, chemical peels, you know, anything to improve the outside of the skin, and also, you know, through surgical procedures. And we have a wonderful plastic surgeon, Dr. Sean McGuire. But we also recognize that aging is not just about addressing the outside.
Sure.
It's also addressing the inside. And so what's important to addressing the inside, I mean, in order to age well and to age healthier and to age happier, is to address our hormones. Our hormones start to decline rapidly, you know, at the rate of 3 to 10% per year after age 30. And when we start to see that drop in hormones, we start to become symptomatic. We don't feel as good. We start to age more rapidly. It affects all aspects of our health and well-being, and also how we look and how well we age.
So tell me about hormone pellets, because it's a different kind of really administering hormones.
Yeah, so hormone pellet therapy, there's different types of hormone replacement therapy. There's synthetic, and then there's natural. Most people are familiar with synthetic forms of hormones, and synthetic forms of hormones typically come in the forms of oral medications, injectables, patches and creams. They're synthetic, which means they're made from something that's not natural to the body. Most of our synthetic hormones come from urine from pregnant horses, and also from animal parts. And whenever we take, and you know, that's, to me, most people aren't aware of that, but when we ingest or ingest in any form a synthetic substance into the body, then there's an inflammatory response first. And with synthetic hormones, there can be negative side effects. You might get some symptom relief from, you know, menopause and andropausal symptoms, which we'll talk about in a few minutes. But there's so many negative side effects with synthetic hormones that we really are excited to announce that we are partnered with BioTE Medical, who is the expert in natural hormone replacement therapy. It's a network of over 1,500 medical practitioners across the United States who are specialists in natural hormone replacement therapy, and we are one of them. And so we are excited to be offering this therapy as a way to help our patients age healthier and live happier.
How does someone, Marilyn, and we're looking at some of the graphics that you provided, you can refer to those as much as you'd like, or as little as you like.
Yeah, so what are hormones? So basically they're chemicals that are made by the glands, you know, like the ovaries and the testicles, the thyroid. And so these hormones are important to our overall health and well-being and how well we age, because the hormones actually tell our 37 trillion cells in the body what to do and how to react. So when our hormones are deprived, then that causes our cells not to function well, and that can lead to health issues and also feelings, not feeling so good. You know, we won't feel as good as when we get into our 30s, 40s, 50s, and 60s, and we're in the menopause and andropause stages of our life. We start to feel lousy, and we're not quite sure why.
We've covered some of the questions you and I discussed, but I'm curious. So if someone's watching right now and they're saying, "How do I know if hormone therapy is right for me or right for our viewers?"
Okay, so it's really it's a personal choice. You know, if you're feeling lousy and you want to protect against age-related disease, then natural hormone replacement therapy is the right therapy for you. We do encourage you to come in. You can come in and see me for a consultation. We are waiving our $99 consultation fee to our Wave 3 viewers. You just have to mention Wave 3. Come in and talk about it. Let's discuss your symptoms and see if you're a good candidate for it, and we go from there.
What are patients saying about BioTE? You know, now you've had a little bit of a test sample, haven't you? Yeah.
Yeah, I mean, basically our clients are feeling great. They're feeling increased energy levels. They're sleeping better. They're having more even moods, less irritability. They're finding that they're losing weight, particularly in the midsection, because, you know, when we're low on estrogen, that affects whether or not we're gaining weight around the middle. And when we restore it to optimal levels, then we start to see a loss in that area. Also increased libido, increased sexual functioning, and this goes for both men and women. So we're talking about Yeah, so we kind of gone through all that. So,
yeah, so I wanted to make sure we didn't repeat, but this is all important, and I think we can't say it enough, because I think a lot of these symptoms people are experiencing, and they're saying, what I do, and they say, you know, okay, I think I am experiencing this. What in a consultation right now, you'll waive that, correct? Yeah,
we'll waive. If you mentioned Wave 3 Listens Live that you saw me on here today, then call in and schedule an appointment with me, and then we will waive that fee, and I'll help you decide whether this is the right therapy for you. I'll definitely educate you in further detail about this therapy, and you can decide whether this, whether it's the right therapy for you. But if you're feeling symptoms of fatigue, low energy, mood swings, anxiety, depression, lack of sleep, if you're experiencing memory loss as well as depression, if you're feeling that brain fog, I hear that a lot from our patients, hot flashes, night sweats, weight gain that you can't seem to get rid of through diet and exercise, joint pain even as a result of low hormone production, bladder symptoms, severe headaches, including migraines, as well as decreased sex drive, like we mentioned earlier. But Biote hormone therapy is the leader in natural hormone replacement therapy. It's the right kind of hormone. It's natural. It's bioidentical. It exactly matches our own natural hormones at the molecular level. So again, synthetic is not natural. Body doesn't recognize it. It sets off an inflammatory response and has adverse side effects. Natural, meaning the body, it matches our own hormones at the molecular level, so the body recognizes it as if it were our own hormones. And the way pellets are administered, it's painlessly injected underneath the surface of the skin. Capillaries form around that pellet within about 24 hours, and then the hormones released directly into the bloodstream, just like our testicles and our ovaries release the hormones into the bloodstream. So we get a consistent flow of hormones 24/7, versus other forms which give you that roller coaster ride, because it might be an injectable or a patch or a cream or an oral medication, and you're just getting a flush of hormones at that time. The pellet therapy gives you that consistent, just like our ovaries and testicles.
Something else I think that's important to stress, Marilyn, is that we talk about direct doctor supervision.
Yes.
That's something that I always talk about when I talk to Dr. Sean McGuire, because I do think that's important. I think a lot of these companies, little pop-up buildings that are coming up now, and they have just someone who may be a registered nurse, whatever the case may be, but Dr. McGuire, very respected.
Yes.
That's really important to him.
Yes, Dr. McGuire is overseeing this program. We have a nurse practitioner on site as well. The first step is to see me for an education on natural hormone replacement therapy. Then I send you for blood work. We do an extensive comprehensive blood panel to see what your levels are, and then we also look at your symptoms, and then you meet with the nurse practitioner who goes over the blood work with you, and then the dosing is a prescription for you. It's not one size fits all.
Right.
There's a customizable dosing that meets your whatever you're deprived of. Then we're going to optimize those levels to a more youthful level, similar to when we are in our 20s. So the goal is to help you feel good, feel better, and to protect yourself against age-related disease.
You've done a great job at articulating this, Marilyn. I really appreciate it. And again, if you think, look, this may be for me, hormone therapy may be for me, Biote, you have stated, you made a great case for Biote hormone therapy in that form, being natural, less invasive, less inflammatory reaction, that kind of thing. So give them a call today at the Physician Center for Beauty. There's the information on the screen. Again, consultation is free, is that right, Marilyn?
If you mention Wave 3 Listens Live, it is free.
Oh, there you go. I like that. Thank you.
Thank you.
Marilyn Cannon, bearing gifts. I really appreciate it. Okay, again, that's 897-7546. 897-7546. I think that's 897-SKIN.
It is.
It is, okay. All right, Marilyn Cannon, thank you so much.
Thank
All right.
you.
We'll be right back right here on Wave 3 Listens Live.